Okay, so now billing. Here we go. So some logistics regarding billing. Billing is due to Jocelyn every Tuesday by 5 p.m. So you're going to submit your invoice to her per your contract or your employment agreement. Anything submitted after Tuesdays at 5 p.m. will go on to the next billing cycle. You can turn it in person or email it by scanning and emailing it. Do not send text message or pictures of your billing to Jocelyn. So a couple of things that you're going to need when billing is due is your signed signature pages or your teletherapy page and a cover page. So the cover page or your cover invoice should be, actually all your stuff should be in alphabetical order by last name, including all of your clients, and in the notes section, a note for why they were not seen, and it should be separated by insurance type. All of that, cover pages and signature pages and all of that is found on our website in the billing section. All of your notes and assessments all should be signed and completed when you are submitting them for billing. And you need to make sure that you had an active treatment plan at the time you did those sessions, or they are not going to be billable. Okay, so these are the two forms that I'm talking about that you will be able to find on our provider web portal. One of them is going to be in a Google Doc or a Word format, and the other one is going to be in a Excel format. I personally like the Excel format when you have to be adding things because you can program or use the formulas that I have here to add up your totals. So essentially what these two forms are doing is they're serving two different purposes. This first form is your client contracted hours, which is going to tell the dates that you saw the client, the place of service, the time you were there, your code, your units, things like that. All of this is really used in the billing process. So the information that we need in order to bill is, of course, their name, their diagnosis, and all of this important information. We also split it up by insurance company because each insurance company uses a different way of billing, and that makes it much easier for our billing staff. So you'll notice that this form and this form are reflecting a lot of the same information. The purpose and intention of this billing cover page is for you to be adding up how much is owed to you, how much you are billing, or how much you are invoicing to Elements. So essentially you'll see the same clients reflected here as you will see reflected over here, except this is the billing information and this is the invoicing information. And you can feel free to use a couple different tools. If you right click, then it will say insert a row, or same thing on Excel, right click and you can insert a row above. So that is how you would change it. And of course, if your clients move from one kind of insurance and they get turned to another kind of insurance, you can feel free to move them from one category to the next. It's extremely important that you note that these are in alphabetical order by last name, and the dates or small notes about what happened or why you didn't see a client. They don't have to be long, just a simple note of why you didn't see them. So there is a template, like I mentioned, on the members only portal for your billing invoice and your billing cover page. Your alphabetical by last name, all your clients, the initials only, 2 initials for the last name, 1 for the first name. If you have a couple of clients where that might be confusing, you can add a couple of extra letters in the initials for the first name. Separated by insurance type, on the contract is the type of insurance. So you should know based on your contract what kind of insurance that they have, and your billing invoice should be typed out whenever possible. So I personally type mine. I think it's very easy. You just update it with the hours every single week. If you have a new client, you can just insert a new line on your grid, and it's pretty simple. And then, of course, that should be emailed to Jocelyn and not texted to her, or you can print it and bring it to the office. All assigned or contracted or not discharged clients should be on your list. So even if they were not seen that week, we still want to get an active list of who are the clients who are kind of on your radar, who you're responsible for. And the notes or comments section should be changed weekly to reflect like if you didn't see somebody or if they canceled or rescheduled or what's going on with them. Me personally, I have a couple of clients who they just call me when they want a session. And so for those clients, I write PRN, which just means I'm basically going to be seeing them as needed. Or write down things like their insurance was terminated and you're waiting for it to come back, or that you need to discharge them. Whatever notes need to go on your page, that's where they go. And that helps Jocelyn or Marcio or who's ever reviewing your billing cover pages get a better idea for why clients were seen or they were not seen. So we use CPT codes for billing. CPT stands for Current Procedural Terminology, and some common mental health CPT codes you will see here. It's going to be a five-digit code. In some cases, it will be 4 digits with 1 letter at the front of it, and we use it to bill. We use this with a diagnosis code in order to receive reimbursement from the insurance companies. When you're diagnosing, that is very important for billing. They have to have a billable diagnosis. All of the diagnoses we use, as mentioned previously, were from the DSM-5 or the ICD-10. And as those update, care paths will update as well. So the ICD-10 is an international kind of system. The DSM was created by the APA in the United States. So the ICD-10 is more of like a worldwide standard, and the DSM-5 is more used for like behavioral health or mental health people in helping to diagnose more specific behavioral health concerns. On your billing invoice, you are going to include a couple of different pieces of information that is used for billing. So it's going to include, of course, your CPT codes and your diagnosis codes. When you are doing your billing invoice, this is important information for independent contractors versus employees. There's some small differences between these, and so you can kind of pause and come back to this. But basically, a 90837 is worth 1 hour. 90834, 0.75 hours, 90832, 0.5 hours, and your family therapy codes are worth 1 hour. For independent contractors, your assessment and your reassessment codes are the same. For employees, you're just counting those as hours towards your hourly quota, or your weekly quota, sorry. And same thing for your XE, your CASI, and your LOCUS, and your PAR. So the treatment plan for anybody is not billable, and it's kind of paid incorporated or into the fee for your session fee. Payday is every other Friday. We do have direct deposit available for $4 per month, and you can set that up with Marcio. Generally, you get paid for every service that you did during that pay period. The only exceptions would be if your documentation was not completed, or you did unauthorized services, or you had a certain amount of units available and you exceeded them, so we can't pay you because the insurance company is not going to pay us for that either. The insurances that we accept, of course, you can come back to this, but we accept all forms of Nevada Medicaid, and we accept a lot of commercial types of insurance too. And if you have a question about that or someone's asking you, just ask Jocelyn. We also accept insurances that have out-of-network benefits, and clients at any time can call the office to verify their benefits to see if they can receive services from Elements. If you want to help a client with that, she's going to need their full name, their date of birth, their insurance number, and if they don't have Nevada Medicaid, she's going to need a picture of the front and back of their insurance card. Calendar year limits. Again, this is one that you're probably going to want to come back to. Every one of us is seeing fee-for-service clients or FFS Medicaid, and that would be listed on your client acceptance contract. Calendar year limits for fee-for-service Medicaid are listed here. Typically, we say that it's a safe bet that most of our children get about 26 sessions or 4 assessments per calendar year. depending on their CASI or XE score. For the locus, as you can see, it varies widely, so you have to really keep track, especially for adults, how many sessions that they have used that year. And everybody, no matter what their locus score, gets 2 assessments per calendar year. And a calendar year is just like it sounds, January 1st to December 31st. Additional services might require prior authorization if you want to go above these limits. And PSR and BST will be and must be requested on a prior authorization. Calendar year limits for Silver Summit Health Plan. This is, again, all listed on your client acceptance contract. So you are allowed basically 24 sessions per year or calendar year for Silver Summit. And it does not matter what their XE or CASI or locus score was. If you want in-home therapy for Silver Summit, however, the units are much more restricted. 12 units means 3 one-hour sessions are allowed per year in home before you need a prior authorization. So there's no written limits for the assessments, but we just go off of the guidelines of fee-for-service Medicaid for this, which is from Chapter 400. Again, other services do require a prior authorization, and BST and PSR can be requested for Silver Summit clients. Anthem Blue Cross Blue Shield clients, they do also need a XE, a CASI, and a locus, and a treatment plan every 90 days, but there are no session limits, so you're not going to need, at this time at least, a PAR for therapy for clients with Anthem Blue Cross Blue Shield. And in-home therapy, which is our H0004 code, and PSR and BST are covered services, and those can be requested on a PAR. Health Plan of Nevada is the most restricted type of Medicaid that is offered. You are not reimbursed for a XE, a CASI, or a locus, and they also do not cover in-home therapy or PSR or BST. So if you have a client who wants to switch insurances, this is the kind of insurance that is the most limited with regards to the kind of services that they can receive through behavioral health. They still need a treatment plan every 90 days, and there are no session limits for therapy, which is nice, so you don't need a PAR for clients who have Health Plan of Nevada. Calendar year limits for if they have commercial insurance or other sort of cash pay. So if they're commercial insurance, we're not doing any XE, CASI, or locus. They still need a treatment plan, and it might have session limits, but just ask Jocelyn to verify that for you. And with cash pay, you have a lot more freedom. We still are not doing an XE, CASI, or locus, but they do still need to be provided services that are congruent with our ethical standards. So they do still need a 90-day treatment plan, and you and the client will determine what kind of session limits there will be. So if they want 2 sessions a week, if they're paying cash, they're allowed to have that. On your billing, a reference point here, the place of service codes that you could use, 12, 11, 02, or 99, depending on if they are home, office, teletherapy, or other. That doesn't fall into one of those categories. Now again, you're probably going to need to come back and review all of this, but this is just a brief overview. When you are doing a screening like a CASI, a locus, or an XE, the CPT code for that is H0002. That can be billed every 90 days, and it is 1 unit. Again, we only use that for fee-for-service, Silver Summit, and Anthem Blue Cross Blue Shield. For an assessment, it depends where you are when you're doing that assessment. If you are in the client's home or you are on teletherapy, you are using 90791, and it is 1 unit. If you are in home doing that assessment, it is H0031, and that is 1 unit. Both of these, it does not matter how long it takes. They are not time-limited codes. So if it takes you 30 minutes, if it takes you an hour and 30 minutes, you still bill it as 1 unit, and it gets paid the contracted price for that service. Billing CPT codes for individual therapy. Again, depends if you're in the office or if you're in the home. In the office, you can bill 90832, 34, or 37. This also applies for teletherapy as well. Technically, people call 90832, for example, a half-hour session, or 34 is a 45-minute session, or 37 is a 60 or hour-long session. But the time ranges are written here. So any session that ranges between 16 to 37 minutes is billed as a 90832, which can be helpful if you have a client who cannot make it 30 minutes for a session, like a little kid maybe. So that is helpful. 38 to 52 minutes is a 90834, and as long as your session is 53 minutes, you can bill a 90837. So a 53-minute session, according to CPT and Medicaid guidelines, is a 1-hour session and can be billed as such, giving you a little bit of time between sessions, maybe to write some notes or to go to the restroom or attend to your own personal matters. In-home therapy is billed with this H0004 code, and that can be individual therapy, family code, or a blend of the two, and it is a 15-minute code. So if you're there actually for 1 hour, you are billing for 4 units of H0004. Special considerations for this. Okay. It gets a little bit complicated, but basically a couple of different things. This code, when requested, is considered behavioral health counseling and therapy. But as I mentioned, the 15-minute or 4-unit code, that's all relevant. On the client's medication documentation from Medicaid, it is going to appear as alcohol or drug services, which is not what it is. And your client may ask you about that. And the explanation that we have received from Medicaid is that this code covers a couple of different services, and it just happens to be that this alphabetically comes before this. And so what it lists as on the Medicaid documentation is alcohol and drug services. But this is for community-based services, not office services. So when you are counting sessions, if you're counting like your 26 available calendar year sessions for your client, this gets a little bit tricky. If you do 1 to 4 units, it counts as 1 session. But let's say you do like an hour and a half long session, it would seem to you and me like it was 1 session, but Nevada Medicaid is going to count that as 2 sessions out of your 26 session bucket. So if you are consistently doing 1.5 hour or 2 hour long sessions with your client, you're going to burn through your available 26 sessions a year very quickly, which you are allowed to do, but you have to know you're going to have to do a PAR sooner rather than later if you are doing that. Medicaid also will typically not approve this H code for individual in-home therapy along with like an individual like 90837 or 90834. So you really need to determine which setting you're going to be providing these services in and be able to justify especially why you want to be having the in-home therapy for these clients. For family therapy, in-home or in the office, you can also use these codes as well. If the patient is present, we use 90847. If they are not present, we use 90846. Each of these codes is a 1-hour code that ranges in length of time from 26 minutes to 50 minutes. So literally a 26-minute family session can be billed as either of these. This can also include therapeutic supervised visitation that you're doing for parents with their children who are living in foster care. I oftentimes use 90846 to do therapy with, like, let's say a parent of a child, but the unit of treatment is still the family, but the client is actually not present for that session. So if you're not sure if you are billing individual or family therapy, here's like kind of like a quick guide. Who was present for most of the session? If it was identified client only, or were they with family? And what did the session focus on? The unit of treatment is what is so important here. And then how long was that session? You kind of see down here. So these are how you kind of can filter your way down to what should you be billing for a particular session. CPT codes for PSR and BST are listed here. H2017 is for PSR and H2014 is for basic skills training. So the hours of this are billed in 15-minute intervals as well. So 4 units is 1 hour, 6 units is 1.5 hours, and there are limitations based on the CASI or LOCUS or EXI score of how much they can receive per day, but the maximum limitations are written here, and you will reference those, of course, when you're writing your PAR. Crisis CPT codes are such as H2011. If you have a Medicaid client, again, 15-minute intervals. If someone else joins you in that crisis, then you would use this modifier of HT. If you have a client with commercial insurance and you are doing some sort of in-office or teletherapy crisis intervention, you can use these crisis codes as well, which allows you to bill for more than an hour. So if I have a client who calls me in crisis and I stay on the phone or teletherapy with them for basically longer than this code allows, if I do an extra 30 minutes, because it was urgent and they had maybe a history of being in a crisis or it was very highly stressful situation or life-threatening, you can use both of these codes together if the session lasted basically 75 minutes or longer. Crisis limitations do depend on their CASI scores or LOCUS scores. In the case of a maximum of hours per day or the maximum of occurrences that they can have over a 90-day period. So my personal opinion is that if you're having to go and do crisis work with them 4 hours over a 5-day period per day, they should probably be hospitalized at that point. So you really need to use your best judgment. For telehealth, a couple of considerations. Remember, the codes of H0004 and H0031 are not used for telehealth. I mean, I know that the client is probably in their home, but you are not in their home, so you're not billing those. Individual therapy codes still apply, and here's how they count on the billing page. Family therapy codes still apply, and here's how they count on the billing cover page. Your assessments, again, has to be 90791, and your place of service is O2. When it asks for session method, you are using, of course, a HIPAA compliant method, so you can write whether you use Doxy or Zoom or some other HIPAA compliant method on your cover page. For teletherapy, since you're not seeing the clients all separately, you're using one billing invoice to submit all of your teletherapy sessions on the same page. And here is some example billing that you would do like for sessions 1 through 3. Again, I know this is a lot of information, but this is something you can come back to and reference. Your first session, you could be billing H0002. Then your next session, you're billing an assessment, whether it's in-home or in-office. You're doing your treatment plan, maybe a PAR, and then you're billing for your sessions, either an in-office session or an in-home session or a family session, and then maybe also doing a PAR. You can submit billing for a PAR for reimbursement on your cover page. And there's examples of this billing on our members only portal. This is a reference here of what can and cannot be billed in the same day for compliance and compatibility. You cannot bill 2 908 codes in the same day for the same client. But if you're an individual therapist and a different family therapist sees them that same day, that would be the exception on that. So just be careful. You also can't bill your in-home assessment and your CASI or locus or EXI on the same day, but you can bill an assessment and a session on the same day. You can bill the session and a CASI, for example, on the same day. So please, please, please ask about this. We don't want you guys to be wasting your time or doing services that could be billable and you're not receiving reimbursement for them because you weren't sure. So please ask about this. I know it is and can be very overwhelming and confusing. Other special considerations for in-home therapy. If you have a lot of clients in one home, you can stay in the home and bill for multiple clients over the course of multiple hours. So you can't overlap your billing and you want to make sure you're keeping track of your units and you're doing medically necessary treatments that are in alignment with your treatment plan. But if you can confirm all of that, then you're good. If you have 2 clients in the home, you can stay for 2 hours. If you have 3 clients, if you want to, you can stay for 3 hours. It is totally up to you. The location is also up to you. Where do you want to meet this client? As long as they are willing to do that, that is something you work out with them. Reasonable confidentiality is what we're asking for here. They sometimes will waive their confidentiality, like if you're going for a walk, but you want to encourage them to recognize the limits of confidentiality when they are outside of a traditional therapy office. And wherever the location is, you would change that location code on that billing cover sheet.